Abnormal uterine bleeding is bleeding that lasts longer than normal or is heavier than usual. It can be unpredictable and in some cases it can occur suddenly. It is important to learn about what causes abnormal uterine bleeding and to understand that there are treatments available to help regulate menstrual periods if irregular and heavy bleeding is affecting your quality of life. But before we get into all that, let's get to know the uterus. The uterus consists of two layers. There is a thin inner lining called the endometrium and a thick outer wall called the myometrium. Menstruation happens when the inner lining of the endometrium thickens to prepare for pregnancy and then sheds when pregnancy does not occur. Usually, a menstrual period happens every 21 to 35 days and lasts about 5 days. However, if you have bleeding in between periods, bleeding that lasts more than 7 days, extremely heavy bleeding, or bleeding after sexual intercourse, you may be experiencing abnormal uterine bleeding. There are many reasons for abnormal uterine bleeding. There may be non-cancerous growth in the uterus that cause bleeding, such as polyps and fibroids. Conditions such as endometriosis and adenomyosis can cause painful and sometimes irregular periods. Cancer of the uterus or cervix may also cause bleeding, although that is more rare. Hormonal changes or disorders may also lead to irregular bleeding. Polycystic ovary syndrome and thyroid disease are two conditions that cause hormone imbalance, which can lead to irregular bleeding. Some medications may also cause abnormal bleeding, such as blood thinners, anti-inflammatory drugs like aspirin or ibuprofen, and herbal remedies like ginkgo, ginseng, or motherwort. Before stopping any prescribed medications, talk to your doctor if abnormal bleeding does occur. In order to diagnose abnormal uterine bleeding, your healthcare provider will need to get a complete history. They will do a physical exam, including a pelvic exam. There are also tests that may be recommended to you. First, you will be given a pregnancy test to make sure you are not pregnant. Once this is ruled out, more tests may be recommended, such as blood count test, a thyroid level test, sexually transmitted infection test, pap smear, and blood disorder testing for people with certain risk factors. If further testing is needed, an ultrasound may be performed, or your doctor might recommend a hysteroscopy. This is a procedure that uses a camera to see the inside of the uterine cavity to check for issues such as fibroids or polyps. There are many treatment options for abnormal uterine bleeding. The choices offered to you will depend on the cause of your bleeding, your age, your medical history, and whether or not you want to get pregnant in the future. For sudden and heavy bleeding, and for bleeding that has lasted for several months, you may be offered IV hormone therapy or high doses of birth control pills or progesterone pills. There are other non-hormonal medications that might be recommended to help with clotting. These treatments are meant to stop the current bleeding, and they may also reduce blood loss for future periods. If your irregular periods don't bother you, you may choose no treatment. There are also surgical options available for bleeding that last many months. If you have fibroids or polyps, they can be removed from the uterus to reduce bleeding. Your doctor might also offer an endometrial ablation. In this surgery, your doctor will remove the lining of the uterus. Another option is a uterine artery embolization that blocks the blood supply to fibroids. Finally, Hysterectomy or the removal of the entire uterus is a final treatment option. Hysterectomy might be necessary or helpful for women who do not want to get pregnant in the future or if there is a concern for cancer. The most important point to remember is that if you are experiencing abnormal uterine bleeding, it is important to talk to your doctor, especially if it is affecting your quality of life. There are treatment options that can help reduce bleeding and make your periods more regular.